Now let's look at nutrition in health and also in diseases. That's its clinical applications. So with this, we'll look at the relationship between diet, nutrition, and health, and also explain the relationship between nutrition um, and genetics, and also nutrition, genetics, and health, and describe the role of diet in the prevention and management of diseases. Yeah, so this mind map will help recall everything that we know about, at least most of the things that we know about nutrition and health. Yeah. Just so you remember this quote from Hippocrates that let food be thy medicine and thy medicine be thy food. And so actually if you take in the healthy diets and the healthy foods, your food will actually be your medicine, and you wouldn't even need to take medicine on daily basis, which it in turn becomes your food. So yeah, so that's one thing too. You have to mind what you eat, and that will help you prevent several conditions. Even if it's obvious that you get this condition, you taking the balanced diet or the right um diet at the right time will help with all the other functions. Even boost your immune system to prevent certain complications that could arise from any disease condition. The major relationship between nutrition and health is that food, whether macronutrients, micronutrients, balanced diet is needed for human survival, and anything that could go wrong with it could affect the health of the human being. So nutrition is very critical in human growth and development, and every stage of human growth and development requires special nutritional needs. And still on the poor nutrition or the nutrition cycle, you realize that um, the whether inadequate food, health care, and inadequate amount of macronutrients or micronutrients, it affects the entire nutritional cycle. So at the level of a malnourished woman, or pregnancy with a pregnant woman with low weight, it could even affect the baby having low weight gain, low birth weight too, and then that of the malnourished woman to also giving birth to a baby with that same birth weight, and that could lead to impaired mental development or developmental delays and other higher mortality rates for the neonates. And also, even when they grow up, there could be increased risk of adult chronic diseases, and as a child, with stunted growth, and also as an adolescent, there will be reduced capacity and so many issues too. And yeah, so this entire nutritional cycle will be affected at every single stage, whether adult, adolescent, child, birth, baby, neonates, and also that of the pregnant woman. So like I said, the effects of poor nutrition in pregnancy could lead to premature birth, low birth weight, inability to breastfeed, increased complications at birth, malformations in babies at birth, impaired development of brain, increased risk of chronic diseases later in life, and developmental origin of diseases too. When it comes to childhood, the effects of poor nutrition in infancy and childhood has to do with the stunted growth, like I talked about, poor growth, poor cognitive development, developmental delays, increased risk of diseases, um, poor muscle development, poor social development, and poor performance in school. And with adolescents, um, once there is poor nutrition, could lead to delayed sexual maturation, loss of final adult height, osteoporosis, hyperlipidemia, obesity, and even other chronic diseases too. With the adults and elderly, there'll be reduced productivity, obesity, cardiovascular diseases, um, cancers, osteoporosis, and several others. So, nutrition has a bearing on the causes and severity of all manner of diseases. But there are some diseases that are associated with overnutrition. So, there should be optimum nutrition for health, and there could be overnutrition and undernutrition, and both can affect health. So, with overnutrition, there are disease conditions that are associated with them, like obesity, which could lead to cardiovascular diseases, hypertension, cancer, type 2 diabetes, and then with undernutrition, could lead to kwashiorkor, marasmus, anemia, neural tube defects, beriberi, pellagra, and several other nutritional deficiency disorders. Now, with the relationship between undernutrition and infection, undernutrition, of course, decreases immunity, which increases the risk of diseases, then leads to infectious disease. With that, there will still be increased energy needs, but then there will be decreased appetite, decreased nutrient absorption, and increased calories needed for to fight infection, and even with the other proteins for antibodies and the rest. And a balanced diet for, apart from the medical intervention, they are all needed to help boost the immune system. But this, with the increased energy needs, will still go ahead and lead to undernutrition, and the cycle keeps on and on and on. So there's a medical intervention. The metabolic response to disease, actually, there's always altered metabolism in illness, and stress response, nutrient utilization. The catabolic states and the anabolic states will be altered. Also, hormonal influences comes in, the energy expenditure changes, and with protein turnover modifications could happen based on the disease condition the patient is suffering from. Still on the relationship between malnutrition and health, you realize that with the malnutrition, there's immunosuppression and susceptibility to infection. But with normal, optimal nutrition, there's normal immune function. But with overnutrition, there will be immune activation and susceptibility to inflammatory diseases as a result of obesity and the rest I mentioned. With some diseases related to malnutrition, the impact of malnutrition on hospitals, it leads to long stay, of course, increased risk of mortality, increased cost of treatment, increased risk of infections. But with the diseases related to malnutrition, Parkinson's, and even with that, there'll be inability to eat or even cook, and anorexia too, inability to process foods, like swallowing difficulties, and food intolerance, allergies, celiac disease, poor digestion of food, even pancreatitis, and all these other conditions, impaired food absorption in some bowel syndromes and cystic fibrosis, and altered metabolic requirements too. So there are so many diseases related to malnutrition. Nutrition in disease management, of course, despite the pharmacological, non-pharmacological, non-pharmacological, non-nutritional, there's still the need for nutritional management in diseases. like in diabetes management, cardiovascular diseases, renal disorders, gastrointestinal conditions like celiac disease, Crohn's disease, inflammatory bowel syndrome, ulcerative colitis, cancer-related nutritional disorders, metabolic syndrome, even in burns, weight management, HIV, and several other conditions too. When it comes to the role of diet in disease prevention, there have been several studies like changing diets in whether fats, salt, refined sugar, decreased fruits, and vegetable intake leads to some chronic conditions like diabetes, cancer, obesity, osteoporosis, and other cardiovascular conditions. And with diabetes, some studies have linked it with increased BMI, but that's body mass index, adult weight gain, hip weight to hip circumference increase, the increased waist circumference, saturated fats, decreased intake of unsaturated fats, decreased intake of vegetable fats, decreased intake of polyunsaturated fatty acids, and also that of dietary fiber and the rest. And the influence of nutrition on genes and disease prevention. Know that nutrition has impact on how the genes are expressed, and some diseases arise as a result of an individual's genes. So with that, there is two major categories you can look at: genomics and genetics. So with the genomics, it has to do with the effects of nutrients and other food components on the genes, proteins, and other metabolic processes, while the nutrigenetics has to do with the mechanism by which the individual genetic variation affects the interaction between diet and disease. So the genomics has to do with the effects of the nutrients and other food components on the genes themselves, the proteins and other metabolic processes. But the nutrigenetics has to do with the mechanism by which the individual genetic variation affects the interaction between the diet and disease. With Baker's theory and development of diseases, and that's of the Dutch hunger study. That's what has been summarized in the nutrigenomics and the nutrigenetics I explained. Diet and management of diseases. Like I said, dietary modifications can help in the management of several diseases, and good nutrition actually improves the outcomes of diseases. So later on, we'll look at several conditions, their etiology, pathophysiology, medical management, and also the medical nutritional therapy. We'll revisit DM, diabetes mellitus, obesity, renal disease, cardiovascular disease, hyperlipidemias, peptic ulcer, irritable bowel syndrome, hypertension, nutritional anemias, and burns.